Hi guys, welcome again to the calming shores of Dr. Puja Opal. This is episode 2 of our ongoing podcast. Dr. Puja is here to discuss healthcare issues, and today we'll spend time discussing Vicodin. The purpose of the show today is to discuss the addictive properties of Vicodin. With that, I'll say hello to Dr. Opal.
Hi there.
Welcome to the show.
Thank you.
All right.
I'm happy to be back.
So, would you like to add anything?
No, I completely agree with what you're saying. Vicodin is a medication that a lot of people are not aware of the risk of using chronic Vicodin. I mean, it can lead to chronic addiction. And I think, we'll get into that as we go on. So don't worry, I'm not going to give away all the secrets right away.
Okay. All right, let's get started.
All right.
Let's begin by getting a better understanding of Vicodin and why it's one of the most prescribed opiates in the world.
Sure. First of all, it's one of the most prescribed opiates in the world because it works really well. It is a medication that
It does its job.
It does its job. It prevents you from feeling pain. Vicodin is a medicine that we prescribe for people that have acute injuries, or if you've had surgery. Surgery hurts. Your body literally has been cut, so it needs very strong pain medications that block your mind from knowing that you're experiencing the pain.
Okay.
So what I'm going to do is I'm going to kind of break down my discussion of Vicodin in about 4 sections. So the first one, I'm going to talk about the makeup of the medicine. Vicodin is made up of 2 different types of medicines. The first one is Tylenol, and the second one is hydrocodone.
And Tylenol, I'm assuming, is the very same that we see at CVS, Walgreens?
Exactly. So it's the same acetaminophen that we see at CVS and Walgreens, and it's that same acetaminophen that will cause acute liver failure if you're consuming more than 4,000 milligrams per day. I mean, this is one of the leading causes for people to get liver transplants. It's because they're taking too much Tylenol.
I see. So combining Tylenol, or the pharmacists, the drug makers, they combine Tylenol to hydrocodone.
That's right.
And that results in Vicodin.
That's right. So when we have pain in our bodies, and we're not taking any medications, we have natural endorphins that go and attach to pain receptors in our mind. They help us block the sensation of pain. So hydrocodone is similar to one of those natural occurring things in our bodies, and it goes and it blocks that, and our mind is not cognizant of the fact that, hey, I just was cut open because I just had surgery.
Okay, great. So that's Vicodin itself.
That's Vicodin in itself.
So I feel like doctor shopping. Why is that bad?
So the term doctor shopping is a term that we use for patients who go from one clinic to the other getting Vicodin prescriptions. If you come to me and you tell me, hey doc, my older physician prescribed Vicodin and Klonopin and Xanax.
Older as in 60 or the previous physician?
Older as in my former physician. Previous physician.
Gotcha.
Prescribed.
It's fine.
Prescribed other medicines to help manage my chronic pain. That's a red flag in my mind. There is a douche that's out there who's actually written a book about how you should be, or how a patient should act to be a good doctor shopper.
Really?
If you purchase that book, or if you take a look at that book, you actually will be the reason for your death. You have to realize that Vicodin is the #1 cause of accidental death in the United States.
Okay.
If you are getting 5 or more refills of Vicodin, say in the past 6 months, that's a sign of moderate abuse potential, meaning that, if you continue
I keep
doing
breaking
this,
my toe, and I keep getting Vicodin. That's okay. But if I'm feeling well and I'm using the medicine continuously, that's a no-go.
No, I actually tell my patients, if you keep breaking your toe, you should get a different orthopedic doctor. But, if you keep getting Vicodin for your broken toe, that's not a sign of a good doctor. Ask for medications.
But I'm breaking the toe, not the
True,
doctor.
you're breaking the toe, but there is a very high addictive personality of this medication.
So I get the feeling, Dr. Opal, you actually don't like orthopedic physicians.
No, I like them. I think they're among the most handsome physicians that we work with.
How come you're dissing them?
I'm dissing them because...
My toe breaks, I take Vicodin. You're telling me to find another doctor? That makes no sense.
I'm telling you that you should be aware that Vicodin is a medication. Think of it as if Vicodin is similar to heroin.
Okay.
The addictive
What's
personalities.
cheaper, heroin or Vicodin? You don't know.
I don't know.
Good. Good. All right, move on, Doc.
um, so
So let's talk about the withdrawal from Vicodin.
mhm.
Will it kill me? Will I feel
No,
pain?
and this is what I commonly see among a lot of my patients who keep getting addicted to this medicine is that, if little Timmy is addicted to Vicodin, what it's going to do once you're withdrawing from it is you're going to have symptoms such as runny eyes, runny nose, diarrhea. You're going to feel like shit. And you're going to, oh, can I say that here?
Of course. That's your
Okay.
show.
And you're going to feel like you're about to die. But the good thing is that you're not going to die. Um,
So, unlike,
so,
say,
so what
heroin,
happens is that a
tell me.
lot of my patients' families or friends are not able to see their loved one in that state, and they feel as if, their loved one is going to die. So what I want them to know is that at that time, take them to a narcotic addiction center. There are rehab centers that are across the United States that help you detox without feeling those symptoms of withdrawal. I
Okay.
mean, there are people who are CEOs of companies to the janitor of a company. So the range is very large. It is a medicine that affects our entire socioeconomic strata.
Understood. Vicodin affects all aspects of life. It
It
isn't
doesn't
for the
discriminate.
street degenerate. Okay, great. So, what should we talk about next?
What I want to talk about next is I am a firm advocate of my patients taking responsibilities for themselves. I take care of my patients, I cure diseases, but I still want my patients to play a certain role in their health
So
care.
you're like a disease ninja, and
I'm
you're
I am like a disease ninja, yes, in many ways.
yeah.
So what I tell my patients is that if you've had a history of drug abuse before, or if you've had a history of alcohol abuse, and you are going to AA, and you see a new doctor and you've had surgery for some reason, and you get prescribed these medicines, just say no, thank you. I have this history. Like, don't for a second be embarrassed of the fact that you were a drug addict or you were an alcoholic, because you know what? Today, that is not who you are.
All right, fair enough. So e- essentially, what you're saying, doctor, is if you are a recovering addict from some type of drug use or alcohol abuse, ask for some other medicine. You
Exactly.
necessarily don't have to take Vicodin to alleviate or relieve your pain. Is that correct?
Exactly. There are other alternatives that are there. Sometimes, when you're having surgery, you have to have morphine because we don't have other medicines that'll take your pain away. But if you are aware that you've had this history, you will be kind of weary of taking Vicodin for like a month after your surgery.
Mm.
The other thing that I see is if you are prescribed Vicodin, just swallow it whole. There are a lot of people out there who actually crush that tablet and sniff it or mix it with other injectables and, use it as a form of IV drug. That's not
No
a
go,
good
no go.
idea. That's heroin in itself. So that's not a good idea. Hepatitis C, hepatitis B, AIDS, all these other problems can come. And if you say to me that, hey, doc, I'm using clean needles, so it's okay, that is not acceptable.
So
Um,
don't crush the friggin' tablet.
don't crush the freaking tablet, just swallow it, take it for a very short time. And you know what? If you are addicted, that's okay. If you are having these withdrawal symptoms, that's okay. I mean, there's a very small percent of the population that can have seizures if they're on a whole bunch of narcotics and they're withdrawing. That's why you need to be at a controlled rehab center of where they're going to help you successfully detox
Sure,
from
I
it.
just want to correct what you said a few seconds ago. If you are addicted, it's okay. By that you mean, of course, that seek treatment. Don't worry that you're going to go down a spiral path.
Exactly.
Okay,
Exactly.
all right. Anything else? Constipation.
Yeah, this is something that we typically see. The number one side effect that most people do get from Vicodin and narcotics is constipation. There is a disease process which is called narcotic bowel syndrome. You will get constipated. I mean, this stuff will totally back you up because one of the side effects of this medicine is that it slows down the normal process of your bowels moving through. So shit, basically shit is not moving through your bowels. What can happen is
It's like a
things,
traffic jam.
it's like a traffic jam, and sometimes you can have leakage. You can have anal leakage because your bowels are not moving properly, and you kind of look down and you don't even realize that you've actually passed some shit. And I mean that's not fun, especially if you're like in public, but it's scary. I mean,
It happens.
shit happens, yes, but shit
3:45
happens,
mark.
but I don't want Vicodin addiction
All right.
happening to
So,
you.
as usual, Doc, this has been very productive. Um, any takeaway message?
Yep, the takeaway message is that just know that these medications are addictive. So when your physician is saying that I don't want to prescribe these because of the addictive personality of the medicines, listen to your doctor and don't be one of those pesky patients that just doctor shops, because we kind of know who you are, and eventually you will not continue to get these
And then you're going
medicines.
to end up on the street and buying crack.
Exactly,
All
and
right.
that's not a pretty place to be.
Fair enough. Fair enough. So let's end this show here.
Well,
Um,
thank you for having me
thank
again.
you for coming, and I look forward to meeting you again.
Yep. Have a good day, everybody.
Cheers. You've been listening to the calming shores of Dr. Puja Opal. Her blog can be found at pujablogs.wordpress.com. That's PUJA blogs.wordpress.com. Medical disclaimer. Please note that the site, the podcast, does not replace medical advice, diagnoses, and treatment of your doctor. Please seek help. Copyright Statement 2013.
Kids, say no to drugs.
No drugs.
No
Bye.
drugs, ever.